thank you for coming. We've now introduced the Minister to most of our esteemed guests, the mayors of many of the municipalities. For those of you I don't know, most of you I've actually met at the mayors meeting. So I'm Karen McGrath, and I have the pleasure of being the CEO for Central Health. Now into my 4th year, in fact. I call myself the longest sitting CEO of Central Health. We are extremely pleased that the Minister has joined us this morning to make some significant announcements with respect to healthcare funding for this area. Minister Kennedy has joined us actually throughout the summer and into the fall, visiting actually the majority of our communities in Central. It's been actually great to have him out with us. He's got first-hand knowledge of the challenges to providing healthcare in an area where they're small pockets of folks, and they are long distances, in many cases, from secondary care facilities. We're pleased to welcome you today, Minister, to Harbour Breton, which would be the youngest hospital on this side of the region. It is a relatively new facility compared to many of our other facilities. The connection of Harbour Breton was always to the Central West Healthcare Corporation, and they enjoyed a very good relationship for many, many years. Harbour Breton continues to provide exemplary service to the citizens of this area and a lot of the feeder communities at ComCare. Trina has been our Director of Health Services now for a couple of years, and certainly comes from the community, is a former nurse practitioner in the community, and certainly brings that flavour to it. So without further ado, because you don't want to hear very much from Karen McGrath, I know that you want to hear from the man of the hour. So the Honourable Jerome Kennedy, Minister of Health and Community Services.
Yes, thank you, Karen. It's a pleasure to be here this morning in one of the most beautiful parts of Newfoundland and Labrador. Absolutely spectacular as you look out there today. I'm very pleased to be joined here by Karen, by your MHA Tracy Perry, and by Mayor Skinner. As Karen's indicated, we've been traveling around the province this summer, specifically in areas of rural Newfoundland and Labrador. When I became Minister of Health, approximately a little over a year ago now, I set 6 priorities, and one of them was to enhance rural health care. As a government, we've always had or recognized the challenges in delivering health services to such a vast geographical area and a population that's spread out through that vast geographical area. In fact, it's only this summer, and I think I've said this on a number of occasions, that Central Health is actually covers the second biggest population next to Eastern and more than Western. And if you look at what the area that Karen has to cover, it goes all the way. We've been up to Bayport Springdale this year, over to, I think, where do we end up close to the Eastern? Where does Eastern end, Karen?
Eastern ends in Tirnova Park, and we start picking up there.
All the way down this way. Now you just think of that, just look at the map, from Bayport down to the coast of Bays. That's quite an area. And Karen is doing, and her officials are doing a great job. But Karen herself is doing a very, very good job. Despite how busy she is right now, she took the time out today to come down here and to deal with this. And sometimes, and I know the CEO is oftentimes a thankless job, but her and her counterparts in this province are doing a great job. One of the reasons I set out to visit a lot of the rural areas of the province is to see for myself the facilities, to talk to the officials, and in fact to see what the needs are. And the fact there's so many mayors here today and so many councillors, I think is indicative of the interest and the concern that everyone has for our communities. I recognize that healthcare is always top of mind for people, and along with economic development, it's a crucial issue. So I'd like to thank Karen for the great job she's doing. And now, I'm going to come to Tracy. And Tracy is small in stature, but strong in her advocacy for her district. In fact, I will go as far as to say that there are times that Tracy can almost, I'm not going to say put me around the bend, because I mean in a very good way. She's very, she cares for her district, and again, Tracy faces some of the similar challenges that Karen faces. Look at the size of this district, and then the islands. And next summer, I'm hoping to come down and see all the various islands and get to all the communities. We were hoping to do it this summer, but it didn't work out. So I made it a priority to get down. I was here this year, last year, or this time last year, I think EPC, our Economic Policy Committee, met down, so we had a good visit. But Tracy has come to me on a number of different issues, raising the issues in the community, and aware of all the communities in her district. Because obviously, in such a vast district, she has to look out for all of the people. And so I'm very pleased that we've been able to get here today and make some announcements. My understanding, when I look at my notes here, is that the Conegra Peninsula Health Centre serves a population of approximately 4,500 people. There are 6 acute care beds, I think, Karen, 12 long-term care beds, a palliative care bed, and a respite bed. It appears to be a very busy centre, and appears to be, I'm looking forward to having a tour, appears to be very, very modern. So what we're going to announce today will be, for this particular, we're going to go to St. Albans and make some announcements later on, but the Conegra Peninsula Health Centre will receive $260,000 in provincial government funding for roof repairs, so to make sure that we keep the facilities in good shape, and another $86,000 for the purchase of lab analyzers and other equipment. So that's approximately $350,000 for this particular facility today, and as I indicate we will be making announcements in St. Albans later today. We're also today we're announcing $95,000 for the clinics for improvements in the clinics in Hermitage and Mose Ambrose. So this funding will allow for the replacement of windows, flooring, and washroom upgrades at the Hermitage Clinic, and the replacement of flooring, parking upgrades, and workstation renovations at the Mose Ambrose Clinic. So again, thank you very much, Tracy. So that one of the reasons of coming to the area is to see the facility. So next year, and Tony Wakeham, the Assistant Deputy Minister in charge of the Regional Health Boards, Tony will be here with me. So then when Karen comes in, we go through the budget process, we see the facilities. And sat next to Tracy as I came down here today, we also had a good chat on the dialysis situation in the Coast of A's region, and this is something that I'll be talking to Karen about a little later on today. And although I certainly can't make any commitments in front of the budget, it is something that we certainly will consider and we will look at. I understand right now that people who are receiving dialysis in this area have to travel, I think, 3 hours to Grand Falls. So anyway, I thank you very much, everyone, for being here. I look forward to visiting, seeing your facility, and I look forward again to getting back where I can spend more time and enjoying this most beautiful area. Thank you very much.
Thank you very much, Mr. Kennedy. I'll now introduce Tracy Perry, who I would absolutely agree with. She's small in stature but mighty in her advocacy. I've had the pleasure of working with Tracy now, I guess, for a couple of years in terms of, we do meet on a regular basis. We meet with all the MHAs and have conversations with them about what they are advocating for related to the community, what the communities are telling them are the health needs of this region. Some of them are easier to deal with than others, and it is always a challenge to provide quality healthcare services in all of our region. It's to provide to our 94,000 citizens adequate healthcare is always a challenge. But I've enjoyed my relationship with Tracy, and she certainly, as I say, has been a very strong advocate for this region. So the member for, I got to get this, Fortune Bay, Cape Lahoon, Tracy Perry.
No, I got it.
Thank you very much, Minister Kennedy and Karen. My voice is a little hoarse today. I think I talked an awful lot this weekend. But it certainly is a great pleasure for me to have the Minister here today and to see our government recognise the needs that we have here in rural Newfoundland. And I see the Mayor of Galtas is here as well, and we certainly recognise there are needs, larger needs throughout the district. The good news is, as we accomplish these, that means our list is getting completed and we'll be able to get to them all over the course of the next few years. Certainly it has been a pleasure for me to work with the Minister in accomplishing our goals for the Coast Bays region. And some big accomplishments we've made, in addition to these announcements here today, there's been millions of dollars invested by Central Health over the last 2 years. And when I was campaigning in 2007, one of the biggest issues that came to me was the ambulance operators and the need for additional personnel and additional equipment and ambulances. So we were really pleased last year to accomplish increasing the budgets of the ambulance operators from 101,000 up to 171,000 by year 4 of the new contract. So that certainly was a great accomplishment for us. In addition, we're also funding activities for seniors and youth through initiatives like the wellness grants and grants for seniors. We've had in this district a healthy eating program and artistry in motion program. So certainly I encourage everyone to continue to pursue these types of initiatives, and we as a government will do what we can to support you. And as mayor, certainly continue your advocacy to Trina, to Karen, and to myself, and we certainly will bring your voice forward to government. So thanks everybody for coming in today. Hope you're really pleased with what's happening and look forward to more to come.
Certainly, by no means least, I'd like to introduce the Mayor of Harbour, Breton, Mr. Eric Skinner, to say a few words.
On behalf of the town of Harbour, Breton, I would like to welcome Minister Kennedy, our member Tracy Perry, and Karen McGraw, CEO of Central Health, and you, the people of our community and region. I am sure when Premier Williams appointed a person to lead the healthcare system, he was looking for someone who is a good navigator, who has a strong course and a steady compass. I believe today, with the announcement that Minister Kennedy has made, we have found that person in him. Through the years, government has maintained a solidarity with the Conagra Healthcare Facility and continuing to support and develop major projects necessary to enhance the quality of care for our residents in Harbour, Breton, and the Conagra Peninsula. And for that, we are truly grateful. We have to preserve and strengthen what is right with the healthcare system. In concluding, I would like to say I am also greatly moved by the spirit and commitment of our volunteer groups, our doctors, nurses, administrative staff, and our entire healthcare team that work hard each day to ensure the quality of life for all of those who are entrusted to their care. Thank you, and we look forward to a continued partnership with our provincial government in all efforts. Have a good day.
Thank you very much, Eric. I just want to make a couple of comments. Last week I was actually pleased to have a visit from Mr. Ross Reid, who's the Deputy Minister for Cabinet Secretariat, I believe. Is that correct, Ross?
Volunteer,
that's right, sector, sorry. And one of the examples he brought to me of an activity which he was highly supportive of and looked to see how we could essentially transpose it across the province of Newfoundland and Labrador was in fact the intergenerational cafe here in Harbour, Breton. And so it is an excellent example of this community working together. I do know about the youth network here. I've had the pleasure of going to the youth network in the past. We have staff members who were instrumental, in fact, in supporting that youth network when it started. I know we have a daycare centre here in Harbour, Breton, which is as a result of all the advocacy about primary health care. So this is a community that essentially works extremely well with Central Health and with this organization to ensure that we're responding to the needs of the population here. So hats off to you all. I think you're a demonstration to the rest of the province. So that brings to conclusion the formal part of this. We would like, actually, if any of you would like to join us for a tour of the facility. Trina is going to give a small tour of the facility. And again, I want to thank our partners, the municipal leaders, for being here. Always have great conversations with them at least once a year when we strategically sit down and have conversations, but I'm always welcome to have other conversations at any time. So please enjoy us for a bit of refreshment and also to go with Trina around the facility as she shows it to the Minister and others. So thank you very much, and everybody have a great day.
The Harbour Breton Community Youth Network will be celebrating its 10th anniversary on Saturday, November 27th at the Harbour Breton Lions Club. There will be a buffet-style reception starting at 6:30 with a dance to follow until 12 a.m. There will be prize draws throughout the night, and the door prize will be a laptop. All youth are encouraged to attend. This event is not open to the public, by invitation only. However, if you attended high school from the years 2000 to 2010 and you would like to attend, please call the CYN at 885-3040 or email Chantel Cribb at thecyn@live.com.